Hi, my name is Chad Porter. I'm going to do the 8 preliminary steps to the SOT protocol. First, I'm going to do the distortion analysis. I'm going to have my patient stand right here and face that way. I'm going to be sitting. I'm going to take my thumb, place it over their acromion. I'm going to have their hands at the side and have them close their eyes. And I am looking for any A to P sway greater than 1/4 of an inch. And that's going to indicate category 1. And she actually does have A to P sway. I'm going to have my patient face away from me. Again, I'm going to take my thumb, I'm going to place it on the S2 tubercle. Patient's eyes are closed with their hands to the side. And now I'm looking for left and right sway, which would indicate a category 2. And she has no sway left or right. For a category 3, I'm just going to exert my patient and they would be presenting with an antalgic lean. The next step for the first rib palpation, I'm going to have my patient sit down and face that way. I'm going to palpate the posterior tubercles of the first rib heads. I'm then going to have my patient flex all the way and extend their neck, and I'm feeling for motion of the rib heads. Okay, thank you. So hypermobility bilaterally would be a category 1. Unilateral hypermobility would be a category 2, and then if there was no movement or hypomobility on both sides, that would be a category 3. Alright, I'm going to have my patient lay down and do the cervical indicators. I'm going to palpate the spinous processes as well as the transverse process on both sides of the cervical spine, and I'm going to ask my patient if any of it is painful or tender. So category 1, we would have bilateral lamina pedicle junction tenderness at C3. Category 4 would be on the left side tenderness at the lamina pedicle junction. And then category 3, we would have a relationship with the Lovett brothers relationship, where it would be matched up with the lumbar spine problem. So if it was tender at the spinous process, then that would be the mammillary process of the lumbar, or if it was a TVP of the cervical, it would be the spinous process rotated to the lumbar. Next, we're going to do the cervical compaction test. This is used to decide if we have a primary cervical subluxation. I'm going to lift my patient's head up and have them put their feet together and raise them up about 18 to 24 inches, not that far, but she did good. I'm then going to compact her cervical spine and have her do the same thing. Okay, so if it would be easier when I'm compacting, that would indicate a primary subluxation. I would then correct this using the stair-step method. So I come in here and I compress the cervical spine, and then I take it from a P to A arc. And what I'm feeling for is the facets to clunk together. There should be 4 distinct notches. To clear that out, if there was a smooth spot, I would go into that area and then I would use a figure 8 to correct it. If it's in the first spot, which is the C7 T1, I would go to the T1 to T4 and check for anterior thoracic subluxation. Alright, so next is basic 1. This is going to be used to balance the CSF flow. I'm going to come behind my patient, I'm going to take my 4 finger pads, place them lateral to the EOP and just inferior to the superior nuchal line, and feeling for pulsation. I want an even pulse in all 8 fingertips. This could take about 30 seconds to a minute to even out depending on the patient. So we would clear that out and then we would move on to basic 3. So basic 3, I'm going to palpate down the sagittal suture, feeling for nodules or any tenderness. So if there's anything tender, just let me know. So let's say there'd be a tender spot or a nodule. I would then cross my thumbs on either side of the sagittal suture and place my fingers on the parietal ridge. And as the patient breathes, we would do this for 3 respirations. I'm going to pull up on the parietal ridge as I separate laterally with my thumbs so that I don't clunk the sagittal suture together. We do that for 3 respirations. Alright, so next is going to be the psoas test. I'm going to take my patient's arms at the forearms and I'm going to distract them. I'm going to have them place their palms out and bring their arms together. I'm going to come down. Can you tell me which one is shorter?
Alright.
The right. Okay, so we would want to do a category 2 correction. I'm going to have them bring that right leg up. I'm going to stay in contralateral. Is it okay if I reach through here and stabilize your pelvis?
Yes.
So I'm going to reach through and stabilize. I'm going to come in on the psoas. Have the patient take a deep breath, and every time they breathe out, I'm going to push in. We're going to do that 3 times. When I finally am the 3rd one, I'll be at the psoas, and I'm going to friction the psoas and release any adhesions. Deep breath for me. Again. And one more time. We're going to clear that psoas. That's how we're going to clear the psoas. Alright, so next we're going to do the anterior iliofemoral ligament. I'm going to come down to the ankles and I'm going to check for internal rotation. Normal is 45 degrees. They're actually both normal, but let's say we're going to do this one. I'm going to come to the greater, you rotate your foot in and out for me. Find the greater trochanter. I'm going to come superior and posterior an inch. Alright, I'm going to have you internally rotate, and then I'm going to have you externally rotate as I pull up. Alright, we do this twice. Okay, and now the 3rd time, I'm going to have her do it very quickly as I stretch that muscle quickly. So on the count of 3, do it as fast as you can. 1, 2, 3. Alright, and for the last test is going to be the arm fossa test. This is the definitive test for category 2. I'm going to have my patient place their arm up, soft fist, palm in. I'm going to have them take their other hand, place it on their umbilicus. Okay, now so I'm going to do a preliminary. Hold for me. Okay, so we're there. I'm going to take 4 fingers, place it on the upper part of the inguinal ligament. Alright, now put your hand to your side. And I'm going to hold, and then I'm going to touch, and then I'm going to pull. Hold. Alright, I'm now going to come down to the lower part of the inguinal ligament. Again, hold, touch, pull. I felt a little bit weak. We'll do the other side. First, we'll do the preliminary test. Hold. Hold for me. Okay, if you could take your hand, find your umbilicus, come down to your tripod. Alright, just relax. I'm going to come 4 fingers at the upper part of the inguinal ligament. You can relax that hand. Alright, hold, touch, pull. Alright, we're coming to the bottom part. Hold, touch, pull. And that's a little bit weak as well. And that completes my video.